After taking some time to consider all the evidence, the Cork City Coroner has returned a narrative verdict at the inquest into the death of Roy Butler. The 23-year-old died after he suffered a catastrophic brain bleed 5 days after receiving the Janssen Johnson & Johnson COVID-19 vaccine in August 2021. The inquest held in Cork heard of how the Waterford man was a fit, active and talented soccer player who had reluctantly gotten the vaccine so he could travel to Dubai. It heard how soon after receiving the jab he started feeling unwell, and that by day 4 he suffered convulsions, became unresponsive and was rushed to hospital where he later died. The inquest heard evidence from 2 senior safety officers at Johnson & Johnson who said there was insufficient evidence to establish a causal link between a fatal brain bleed and their vaccine, and that the European Medicines Agency agreed with this conclusion. The state pathologist Dr. Margaret Butler in her evidence said she was baffled by the case. She said she could neither rule in nor rule out a potential link with the vaccine due to the insufficiency of medical literature on the matter. In his comments today, Coroner Philip Cummins said that the evidence heard established that not all adverse reactions to vaccines are reported, and that lack of hard data concerning such reactions affects the ability of medical professionals and regulatory authorities to carry out their duties. He recommended that the Department of Health and other appropriate bodies consider undertaking an information campaign on the need for the general public to report adverse reactions.